Hello everybody. Thank you for joining me at Maximum Energy again. Today we want to talk specifically about strengthening the neck in its end ranges of motion. It's swelteringly hot in here because the town council has turned off the electric power in my block of flats. So I'm unable to open the windows because I need to do this recording and I need to keep the sound in, otherwise I could be disturbing my neighbors. So bear with me as I try to stay focused, okay, in spite of the heat. Let me do a slight recap. We are not teaching passive stretching, we are not teaching active stretching, we are not teaching active isolated stretching, we are not teaching forced relaxation, and we are not teaching PNF. Some of you might think this is splitting hairs. I've mentioned this in the other end range strengthening videos, but I've always needed to do this slight recap because there are some viewers who just watch a few seconds of a video and decide, this guy is just teaching PNF, or he's just splitting hairs, and then they just tune off and they don't watch any other videos in which they might get an idea of what we're actually teaching here. So in PNF, let me clarify again. You push a muscle, you push a lever arm to the extreme in terms of the muscle's range of motion. You contract that muscle against resistance, and when it is fatigued, you relax the muscle, and very importantly, now you push the lever arm further to gain that extra distance of movement, that extra stretch, that extra range of motion when the muscle is fatigued and cannot resist. We do not teach that here. And I've given you my reasons. Please watch my other end range strengthening videos to understand this if you want to, okay? And I could do another video to elaborate on that, but not in this video. So this video is about the neck, and we're gonna strengthen the neck in 3 positions on each side, okay? So now I did cover these in some of the workshops that I have conducted for computer related injuries and neck and back care, but I'm going to show you the difference now, being that we are not doing passive stretching, because I did teach passive stretching in the past, especially phase 1 kind of passive stretching to inhibit tight hypertonic muscles. So we're not doing that anymore. I have found that a much more effective way is to strengthen a muscle in its end range, thereby accomplishing 2 things. 1, that muscle automatically gains greater flexibility or greater range of motion because the nervous system senses that that muscle is getting stronger with each training session in the end range, and therefore that nervous system allows you to go further into the end range. This is hugely different, and it is hugely different from PNF or any other kind of passive stretching, because in those methods, you are achieving a greater range of motion without strengthening in the end range. And what will happen is that the body detects, the neuromuscular system detects that you are at greater risk of injury. Therefore, it will constantly tighten, remain hypertonic. And even if you get a greater range of motion, of what effective range of motion can you reach? How effective is that end range of motion for your muscles when it is contracting? How effective are your muscles in their end range of motion if you have achieved them either through passive stretching or PNF? More on this in those other videos and maybe upcoming videos on why we do what we do. Okay, I have spoken about this in other videos on end range strengthening. Not going to go into detail on this. So we need to cover the 3 end ranges on each side of the neck. And I just want to give not only credit here, but create an abbreviation, so a label for this kind of end range strengthening. And I want to call it the Jack Woods method because I first came across it through Jack H. Woods on YouTube. So if you go to his channel, Jack H. Woods, Woods, you will come across his video that, yeah, I believe he claims that he discovered the method, and I won't be surprised. Okay, so I'm not going to go into all the mechanisms of the method here because I've gone through it elsewhere, and we'll probably do some other videos that elaborate on it. But let's get on with the three positions. So if you have tightness in the neck, and there are various possible causes, and we are delving deeper and deeper as we get into the psycho-emotional factors that cause tight necks, okay? Chronic tight neck problem. So whether you believe at this point that it's chronic, it's a psycho-emotional issue related tightness, or you believe that it is a dysfunction in the neuromuscular input, whatever it is, I'm just going to show you the end range strengthening exercises now, and we'll have a deeper discussion on the psycho-emotional part in another video. So let's talk about the upper trapezius. Can you see me? The upper trapezius, okay? The upper trapezius attaches to the clavicle and also attaches to the supraspinal ligament. This is actually an extension of the supraspinal ligament from C2, the second cervical vertebra, all the way to the seventh cervical vertebra. And the reason for this is that the atlas, does not have a spinous process, but this ligament is the ligamentus nuchae, if I'm correct. It's the ligamentus nuchae, which is an extension really of the supraspinal ligament from the thoracic spine, the spinous process. Now let me show you what I mean on this model. Totally forgot about it. So as you can see, the atlas, or C1, does not have a spinous process, so you do not have a ligamentus nuchae here. You have the superior protuberance, and then it attaches to, that ligament attaches to C2, C3, C4, C5, C6, and C7. There are only 7, oops, I'm blocking. C2, C3, C4, C5, C6, and C7. Because there are only 7 cervical vertebrae, as you can see, even with this color-coded spine. And below that, the thoracic spine, that ligament that joins, well, you have interspinous as well, interspinous muscles. But on top of the interspinous muscle, you have the supraspinal ligament. That supraspinal ligament becomes the ligamentus nuchae when it gets to the cervical vertebra. Okay, and then it attaches to the external occipital protuberance. Okay, so that's where they attach, and on the other end, the clavicle. Okay, so we're gonna go with that for now. So if you can see me, why am I pointing out to you what some people might think is superfluous again? Because I need you to see and understand why we do what movements we're going to do. So from the clavicle, if it attaches to the spinous process, in this case the ligamentus nuchae, then in order to bring this upper trapezius muscle into the longest position, when you do this, it's not the longest position. This is the longest position for the scalene muscles, but this is not the longest position for the upper trap. And if you did this, that's actually shortening. It's bringing the spinous process nearer to the clavicle. So that won't do it either. So here's the trick that I actually discovered on my own. Of course, we have such movements in active release techniques as well, but in terms of this particular, in that time I was teaching passive stretching, I discovered this movement on my own, and now I'm showing you how to do it the Jack Woods method. So you're going to keep this shoulder down because it attaches to the clavicle, the upper trap, and you're going to use this hand, the other hand, and you're going to pull the back of the head away. And in fact, your eyes now become closer in the line of vision. The shoulder becomes in the line of vision of your eyes. So it's this. It's not this and it's not this. It's specifically this. Try it out. You'll understand what I mean. So in this position, in a passive stretch, you would just hold it and pull apart using your hands. But in this case, we're actually going to try and move our head back to the center. We're going to try and push this way, but our hand is resisting it. Now you could do it isometrically, hold it for 15-20 seconds, or if you're starting 10 to 15 seconds, and then relax, and then do again, pusher. You push your head this way, yeah? So you're pushing your head this way, but the hand is pushing the other way. And you do another 10-15 seconds, and you relax for a few seconds, and then you do it again. You could do that isometrically, or better still, do it dynamically by doing this. That's a short position. Then eccentrically, pulling it longer with resistance still. Or if you want to take 2 breaths, inhale here as well. Now notice what we're doing when we're moving the spine like that. To activate the core, we are doing 3 things. One is we are activating the PC muscle, stopping urination midstream. We are pulling in the belly button. But to stabilize the neck, we're going to put the tongue, our tongue, on the roof of our mouth. The middle of the tongue and not the tip of the tongue. The middle of the tongue on the area of the upper palate, just posterior to the teeth, to the top front teeth. Yeah, front teeth. Well, yeah. The teeth in front, you're going to place your tongue, the middle of the tongue, up on the roof of the mouth, and you're going to press up hard, okay? So eventually, when you learn how to activate your deep core muscles of the neck, you won't even need to put your tongue on the roof of your mouth, but for learning purposes, now we can do that. So double breath again. Now, remember to do an equal number of times on both sides. Let's do this side. Notice that I'm turning my head away from my shoulder. My eyes are looking away from my shoulder now. And the back of my head is closer to my left shoulder now. Do 10 to 15 times on each side. Okay, I hope you get the idea. It's 10 to 15 times on each side. And in order to strengthen the levator scap, okay, let's strengthen the levator scap now. So the levator goes on the medial border as well as the inferior angle, this angle of the scapula, and attaches to C1 and C1, 2, 3, and 4 on the transverse process. Okay, so where's the transverse process? You will notice that earlier on, the attachments were on the spinous process, right? Yeah, C2 to C7. 2, 3, 4, 5, 6, 7. And we had to turn this away in order to get maximum length on the right side, and turn it this way in order to get maximum length on the left. Now, the transverse processes are these on the right and the left, these horns on the right and left. That's where C1, 2, 3, and 4, the attachment of the levator scapula, they go down onto the medial border of the scapula, of the shoulder blade. So in this case, to get this further, instead of turning this way, which will make it shorter, we want to turn this way. Okay? So if we're strengthening the levator scap on the right, instead of doing this, we want to go here, because that makes it longer. If I do this, that shortens the distance. You get the point? So here again, keep the shoulder down, because this is supposed to elevate the shoulder, right? The shoulder blade like this. Elevation, depression. Deep breath. Provide the resistance that way. Head tries to turn back up this way. Now notice, if you wanted to do it isometrically, you can just keep the head down like that. Press the head up though. Deep breath. But we don't push further, yeah? That's PNF. We don't push further at the end of the breath. That's for the right side. Let's do the left, okay? So in this case, to elevate the scapula, or the shoulder blade, that connects from C1 to C4 on the transverse processes, we're going to do this. Deep breath. And if you want to perform them isometrically, I hope you understood that. If you don't understand that, please give me a message. Write a message for me below in the comment section of this video. Okay, so for the scalenes that laterally flex the neck, let's do the right side. So it's this way now. Okay, we are not performing trigenics lengthening, so we do not have to provide a PDM across the scalenes. Okay, all we need to do is this, but again, it's not a stretch because we're actually pushing our head this way. And our hand is resisting that movement if you do it isometrically, and dynamically if you resist but allow for the movement to take place, the lateral flexion of the neck. So deep breath. Again, when you activate your core, tense your bladder. That's our cue, right? It's actually tensing the PC muscle, contracting the PC muscle to stop urination midstream. That's the imagery. And then we're going to pull in the belly button. Deep breath into the rib cage. This is the isometric part. And dynamically. Perform 10 to 15 repetitions for each side for between 3 and 5 sets with 1 minute rest in between sets. So let's do the left side. So first the isometric part. Tense your bladder, pull in belly button, deep breath into the rib cage. Your head is trying to move back this way, but your hand is resisting the movement of the head. Now dynamically. So there you have it. Those are the 3 positions or 3 exercises, which means 6 for both sides. For the upper trapezius, the levator scapula, and in this case, the scalenes. I hope you enjoyed that, and I hope it will be beneficial to you. There's a lot more to neck tightness, neck hypertonicity, and there's a lot more to neck pain than just these exercises. But these exercises are very important as a step to becoming pain-free. I'm going to share with you a remark by one of the customers in another video, so you have a better understanding on how this is a step-by-step sequential treatment method and not a one-size-fits-all. It's not just one step. This is but one step. The strengthening of the neck and its extreme positions is but one step. Now you notice I only performed like 5 reps, 3 isometric static contractions, and 2 dynamic ones. You should do either isometric or dynamic 10 to 15 repetitions for each side of each exercise, and then repeat it 1 minute later for a second, and then for a third set. And if you're really advanced and you want to go all the way, you can improve to 5 sets several weeks down the road. Don't attempt 5 sets on the first time you attempt to do this exercise, because if you suffer from a neck injury, you're just going to make your orthopedic surgeon or your physiotherapist or myself richer with more treatment. So please avoid injuring your neck. Thank you, and I'll catch you again soon.